welcome to this British Liver Trust annual webinar. It's a supporter update, but really it's a patient update because that's what we're all about. We're all about patients. So to start off with, my name's Audrey and I'm the fundraising director here at the British Liver Trust. I'm going to hand over shortly to Pam Healy, who's our chief executive, and Vanessa Hebditch is with us this evening. She's our director of communications and policy. The other friendly faces will be introduced as we go through the evening. So without further ado, I'm going to hand over to Pam. Over to you. Thank you very much.
Hi, everybody. Welcome. It's really good to see you. It's so lovely that so many of you come here today. So thank you for making the time to come along. And I'm delighted that we're holding this event at the end of an incredibly busy year for the charity during Big Give campaign. And this is the 5th year we've taken part in its matched a giving appeal. And it's a really crucial week for the charity. And this year we've got the opportunity to raise an incredible £60,000 towards our Love Your Liver events next year. So this evening, as we approach Christmas, it is a good time to reflect on what we've achieved this year and to think about our plans for next year in 24. So to start with, some of my standout moments of this year was in January, we started with the year with our Love Your Liver screening for MPs in Westminster, and 92 of them came along, 92. I was delighted and a bit surprised, to be honest, so many people came. That kind of number is unheard of, and it really shows that we're being noticed. We had a great day. It was very interesting, and we're able to talk to them a lot about liver disease. Since then, we've had many conversations with senior people responsible for setting health policy for the whole country. And this is where I feel we're making really, really good progress. And this includes talking at a senior level in the NHS in England and the devolved nations, and also in the regions and counties. And just, 2 nights ago in the Crick Institute, the fact that livers are important and liver cancer is important was being talked about. And that is fantastic, because this was Cancer Research UK talking about their 10-year mission. So we were really pleased to hear that we got a mention. In March of this year, the Health Minister announced that 100 community diagnostic centres in England would have FibroScan services by early 2025. And whilst we've had a bit of a U-turn on this announcement recently, we're still pushing really hard to make sure that diagnosis in primary care is significantly improved. And that was being referred to. FibroScans were being talked about at this event at the Crick Institute. So on the rollback of this pledge, we asked supporters to write to your MP. And over 600 people did that. I mean, that is fantastic, which led to the Conservative Central Office phoning us up and asking us about more information about FibroScan. So I think that's great news. We're being heard. So thank you. Also in March, we launched our new Love Your Liver mobile unit, thanks to the fundraising for the Big Give Christmas campaign in 2022. So thank you to all of you who helped make this happen. We launched the unit in Luton. It was freezing. It was a bit like today, really cold. Was it snowing? Not snowing? Nearly snowing. We then took it to Wales for our first roadshow in 23. And we have screened and scanned over 3,000 people this year, with over 100 people at most of our events. Thanks to having a bigger unit with a bigger presence, we have met many, many, many more politicians and managers of local health boards right there in their local community, in the high streets, up and down the country, to talk about the liver disease crisis and what they should be doing about it locally. So that's just a couple more of my highlights before I finish. We are really, really pleased to have secured a significant grant from the National Lottery in England. where we've secured 50% of the funding to expand what we call our outreach team. And this team of great people provides support by offering face-to-face and virtual support groups. So we hope to be able to provide many, many more of these across the country going forward. And we've also secured funding from Macmillan Liver Cancer Nurse for our helpline. So this is a unique role. We're the only charity who will be able to offer this kind of support for liver cancer patients and their families. And we're currently advertising for the right person to fill this very special post now. And having launched our brand new Liver Cancer UK service last year, we've had many conversations with senior health managers about the need for early detection and cancer surveillance for liver disease patients. Excuse me. And we're opening conversations at all levels. And having a new specialist cancer nurse on our helpline will give even more support to patients and give us a louder voice in this area. So given that my voice is now going croaky, I'm delighted I can hand over to Vanessa, our Director of Comms and Policy, who's going to introduce our patients and give us a flavour of what we're up to in 2024. See you in a bit. Thank you.
Thank you. And I think, as you've highlighted, this year has really seen the Trust support more people than ever before. And it's that whole range of mechanisms, providing information through the website, patient materials, through our helpline, the support groups, but also by affecting real change with policymakers. But tonight, I think we're sort of deviating from our normal format, and we wanted to hear directly from people affected by liver disease, so that we could hear from them about how our work has made a difference. So I'm delighted to introduce some patients this evening who've kindly given up their time to come and share a little bit of their story, so that we can hopefully show some of the impact that we've had thanks to our supporters and our donors. So I'm going to start in a moment with Kevin, who contacted the nurses on our helpline when he was diagnosed. The helpline supported over 5,000 people last year, and the stories that we hear really do show how this service can be a lifeline. Every day we hear from people, the nurses hear from desperate people struggling post-COVID to get an appointment with their GP or their specialist, people worried about their test results, or people who are worried about their loved ones or family members. We really do support people at every stage of their liver disease or their liver cancer journey. So Kevin, can I pass over to you, and can you tell us what happened to you?
Yes. Thank you. It's Vanessa. Yeah, thank you. Hi, everybody. I was a patient, but thankfully, what happened to me was temporary, but it was very, very acute. I'd not heard of the British Liver Trust. I'd not even been ill in my life before, but at the beginning of the year, I contracted what was in the end an unknown virus, and I was called up in the middle of the night to go to hospital because my ALT protein, the one that the liver produces in abundance, had rocketed to nearly 4,000. I was rung up at 2:30 in the morning and asked to get to hospital. The doctor apologised to me. He said, "Kevin, I just take these numbers down and go to A&E." I eventually got there. I was admitted. I was told that I had an angry liver, which I thought, what's going on here? But what happened is I stayed in for 4 days, 5 days, and I gradually the protein levels came down at 300 a day, which was no one knew what was going on, and it was just, thank God that was what happened. And after 5 days, I was discharged. The consultant said, "Kevin, you are a healthy man with a strong liver. It's got a bit angry." He said, because I'm a runner, he said, "Keep on running." So, which I have tried to do, and I'm back running. But in the early days of 2023. When I came out of hospital, I felt lost, and I thought, what's going on? I mean, the doctor said after 2 weeks, things will settle down. Probably within 4 weeks, things will return to normal. But they didn't. I became very anxious. As I found out from looking on the British Liver Trust website, all about what the liver does, that it's a chemical factory and it's got 500 functions. And I realised that then all the kind of stress hormones were out of balance, really. So I tried to go back to work, and I was experiencing high anxiety, and prior to that, I found British Liver Trust, and I called the helpline, and Lindsay, who I just felt I wasn't on my own. It was just somebody knew what was happening in a very easy, explainable way, who calmed me down, and that actually helped, restabilize that point when I just felt very. I described as sitting on the edge of a helicopter about to jump out. So over the next 2 or 3 weeks, when I was having, days that were quite low, I was able to ring, and I rang on another occasion, and I was having heart palpitations, and one of the nurses said, "Look, Kevin, just go down to the doctor and just get an ECG, just clear your mind." And it was just that encouragement to go down there, which helped me through. So my journey is now I'm in a state of good health, but without the British Liver Trust in those early days of 2023, I don't know what I would have done. It was just a godsend on 3 or 4. I mean, I've got lots of family and friends around me, but just to have that specialist knowledge and support at the end of the line was truly amazing. And I instantly donated, because I thought you were all wonderful. And thankfully now, as the year finishes, I'm back into full-scale running. I can now go to a meeting that's very challenging and not have my shoulders locked through muscle tension, because I was just getting too much adrenaline. I just thought, what was going on? And I had endless weeks when I was having, the stomach was fluttering and palpitations. Everything was just out of balance. So, but again, I was just, reassured. I knew that bank of knowledge which the British Liver Trust has provided me, and with the helpline, was just truly brilliant. So I will continue to sing your praises, and I will continue to say to my friends, look after your liver, because you never know when it needs to be strong. Because for me, a post-COVID virus that was undiagnosable had a real go at me, and my liver literally went at the beginning of the year, when I surfed the NHS beds for about 5 days trying to get to the gastro unit, which I did eventually. Yeah, that's probably enough for my testimony, and I think I just would say thank you again.
Thank you. Thank you so much, Kevin. I think you've just really highlighted how important speaking to one of our nurses at that moment of crisis, and how important getting that support can be. Pam mentioned next year, that we're just hoping to appoint the first ever Macmillan cancer nurse to work on a helpline. It's never been done before. And I think that's going to be really important for people with this devastating type of cancer that has such a poor prognosis, so that they can get that sort of specialist bespoke care from someone who really understands. The other thing we really want to do next year is we want to extend the opening hours. We're currently open Monday to Friday, 9 a.m. to 3 p.m. But every single day, some callers don't get through. And we want to make sure that every single person who needs us has that opportunity to get through to one of the nurses and have those conversations. So we're going to be raising funds to try and extend the opening hours. And we also want to be able to promote the helpline more. At the moment, we can't promote it too much because we don't have the capacity. So we want to make sure that every single person who is diagnosed with a liver disease condition can get access to that vital support. Our helpline is a crucial way that we do offer support, but another vital service that Pam mentioned are our support groups. And I'm going to pass over to Steve now, who's going to talk a little bit more about his experience with support groups.
Hi, Vanessa. Hi, thank you. Thank you for giving me the opportunity to speak this evening. And of course, I know I'm speaking about my experiences, but I know when I do speak, I'll be speaking on behalf of so many people that will have experienced exactly the same as I did from my very first meeting, and from that meeting to where I am today. It was really important for me to put that point across from the beginning. So going back to my route, how I got to the groups, in January 2020, I was in hospital for a month. I was diagnosed with a alcohol-related cirrhosis of the liver, a decompensated liver, and a condition called hepatic encephalopathy. Just to give a very brief description of that, what that is where the ammonia and the toxins should leave your body, they don't, they travel to the brain, and it can cause you to be, like it did to me, extremely unwell. But obviously I got through that, but I'd describe January 2020 for me as it was one of the worst in my life. I was a completely lost soul. I didn't know what was happening to me. I didn't know enough about my condition. But towards the end of the year, I'd made a sort of a pact with myself. In the new year, I will try and find an organisation or somewhere where I could talk and learn more about my condition to help me, and also listen to other people to see if they could give me advice. So I set about that task. The first week, January, I went on Google and I found an organisation called the British Liver Trust. I'd never heard of them before. They'd never been signposted to me in hospital or since. And I actually filled in an online form. I remember it. And within no more than 2 days, I got a lovely email from a lady called Amy Caffrey, who was the group coordinator then. And we ended up having a phone call, and I wouldn't say I had to be dragged kicking and screaming, but I had to be cajoled. That's probably the best way to describe it. There was a meeting the following week, a Zoom meeting, she was telling me. She said, well, look, come on 15 minutes early. We'll have a chat. If you like what you hear, stay for the meeting. And I'd never done Zoom before. My mum had, so I knew what to expect. But I've always said, and I'm not just saying it for this evening, that hour and 15 minutes changed my life forever. Because I had a 15-minute talk with Amy and I felt so relaxed. There was no pressure. And then I joined the meeting and I saw, it's really difficult to describe. The only way I can describe it is I saw a sea of normal, that probably sounds really bad, normal faces, because I didn't know what to expect. I'm sure I looked like a rabbit in the headlights, but there were these people there and they were so kind. They talked of their journey. Not all of them were alcohol related, in all fairness, but they talked of their journey. I can remember listening to them and thinking, that's me. I was like that. That was me. And suddenly I felt safe as well. I felt that people understood me as well. And I was able to talk really openly about my own journey. And that's had a massive effect on me. And the thing about the groups is they are a really safe environment. Any groups that I attend, we can say exactly how we feel and people understand you. You don't get judged, and they're a very, very safe environment. And that's for me personally, that's absolutely vital. But of course, there aren't just groups for alcohol-related ones. There's the liver cancer group, there's the young persons group, there's the carers group, there's the NAFAL group, there's the UK pre and post transplant, there's the genetic and autoimmune disease group, there's a UK-wide drop-in group as well. And then in the last 12-18 months, there's been a group set up by Amy and a guy that's become a really good friend of mine, a guy called Paul James, specific for hepatic encephalopathy, which is quite a rare disease. And that's been an absolute godsend for so many people. And I just want to say that from a personal point of view, I know that I would not be the same person as I am today had it not been for that first group I attended back in January 2021 and all the other groups that I've attended, because I've learned so much more about myself. I've learned so much more about my condition. I've learned so much more about lots of other liver conditions. And I've been able to carry on with some advocacy work outside of the Liver Trust now and through the Liver Trust. I've visited a number of the Love Your Liver roadshows and seen the impact that they've had. And they've been a fantastic experience for me. But moreover, more than anything else, I have met in the last 3 years or so some of the most fantastic people I've ever met in my entire life. And for that I am eternally grateful. Because as I say, I know I had it not been for the British Liver Trust, I'm not sure where I'd be, but I'm in a really good place today, thanks to the support group. So with that, again, I'll say thank you very much for the opportunity on behalf of myself and so many other people this evening. Cheers.
Thank you so much, Steve. I just find it so inspiring hearing from people who've been to our support groups, because you can really see that journey that people have gone on. And I'd just like to also thank Steve, because I know actually that now it shares his story, and he has actually been amazing in helping so many other people who have been diagnosed with liver disease and have felt lost and needed someone to turn to. So I'd just like to thank you, Steve, for doing that. As Pam mentioned earlier, this year, because we've got 50% of the money, but we now need to raise the other 50%. But we've got this money from the National Lottery, and we hope to really expand those services across the UK, build much stronger links with clinicians, so that everyone is who's diagnosed with liver disease can be signposted to our support groups and get that help and support if they want it. The other thing that I know Steve's also been involved with, because he very kindly supported us with it, is a research project. Research into liver disease and liver cancer, it's really poorly funded, and as a relatively small charity we can only fund an occasional research project, but we do campaign to try and increase the numbers of research projects that are funded. And just today I was working on a letter to a research funder to see if we can try and encourage them to make liver cancer a research priority, so that more monies is put into that research. But the work that Steve did and lots of other people support us with is making sure that patients are at the heart of research, so that they're input into those priorities, they're influencing at the start of projects, for example, sitting on a steering group or providing input through focus groups, but also making sure that we can publicize research projects, so that patients know about new research trials, for example. So thank you, Steve, for not only helping us with the support groups now, but also helping us on some of those research projects. I'd just now like to pass over to another one of our lovely patients who's been very supportive of us, Shona, and she has been really helping us with some of our campaigning and early detection work, and actually last month attended one of our parliamentary events. So over to Shona.
Thanks, Vanessa. I'm Shona. I have a long running history with liver disease. I was diagnosed as a child, aged 11, which is quite strange in itself. I'm now 32. So I kind of had this weird journey where I didn't really know anyone that had liver disease, and I was very, very alone. I kind of felt really segregated from everybody, and nobody else I knew was sick. And I went through that for a long time. And then I was really sick when I got to my early 20s. And in the past, I had trawled the internet to try and find any sort of support group, chronic illness support groups, but none of them seemed to fit me. I'd felt really alone since my diagnosis as a child, and never really belonged to a community of people that understood what it meant to be sick with anything, never mind liver disease. And I got to the point where I thought about even setting up my own support group locally, so I could actually meet some people face to face that had liver disease, because I think I got to like 26 and had never met anyone with liver disease. So when COVID hit, I think everyone really struggled. But at this particular point, I had been on the transplant list for I think it was about a year. And a year before that, I'd been diagnosed with liver cancer. So I had the liver disease, and I had then on top of it been diagnosed with liver cancer. So I did another Google, and miraculously, the British Liver Trust came up. I saw that there were Zoom groups due to COVID, and I just immediately signed up. They were one of the best things I think I've ever done in my entire life, to be honest. So I signed up in April 2020, and I remember there was only 3 of us, and 2 of us were pre-transplant, and one of us was post-transplant. But even in such small numbers, the groups were just unimaginably supportive. It was just nice to kind of be talking to people who understand what it felt like to be sick and to need a life-saving transplant. And then the groups grew over time. More became available, more people kind of joined in. And I ended up joining multiple groups. So I joined the liver cancer group, the young person's liver group, and I met some incredible people that listened to me about my concerns, taught me about all these different things I still didn't know, would be brutally honest with me, answer my questions, make me laugh hysterically, and sometimes just comforted me when I was just crying on screen, going through like the hardest parts of my life. And they would tell me positive things and just tell me they were all behind me. They had such kind and lovely words. We shared advice to try and help each other on our own journeys, even though we were in slightly different situations. But I've made like lifelong friends, and they've been my backbone through my entire journey. And I really do not think that my transplant journey would have been as smooth if I hadn't had them. So I try to do as much as I can for the British Liver Trust. I hope they agree. But I try to do it because I'm trying to repay that, like, them, and try and be someone supportive for other people who are going through a horrible time, because I felt so alone for so long. I just kind of want to help. I also want liver health to be a priority for the public, and I want to be there for others to make sure no one feels as lonely as I did before I found the British Liver Trust. And I find that the more I talk about my conditions, it's like a therapy. But I also know that the more I talk about the conditions that I've had and what I've gone through, the higher the chances are that more people will be aware of conditions that are similar or the same as mine. So I've done a couple of different things with the British Liver Trust. I kind of just agree to whatever they ask me to do, because why not? So I've written I think I've got 2 parts to my liver cancer story, actually. I think there's a before and I think there's an after. One was like pre-COVID and one was after COVID, when I'd been transplanted. So that's published on British Liver Trust. Happy to appear on any of the social media outlets. I've spoken to the press for newspaper articles. I've been on television doing interviews, on Zoom and in person. But I understand that that's not for everybody, but I do it because, number one, not everybody is well enough to do that. Number two, not everybody is brave enough, I guess, to do it. I'll talk to anyone. But I think that it's important to be open about everything, and the impact that these different conditions have on people. The more we talk about it, the less lonely and scary it will be for those people for when they or a family member are diagnosed. And I think the most scary thing about liver disease is that nobody talks about it. And we feel really ashamed. And sometimes that comes from medical professionals, and that's not okay. The more we talk about these things, the less these things will happen, because there'll be more education to everybody. And it just becomes less scary if we talk about it. But yeah, like Vanessa said, I joined in with the BLT at Parliament to talk to MPs, and I actually really enjoyed it. We talked to hepatologists, we talked to pharmacological companies. We just really highlighted the Liver Cancer A Call to Action report to show how important it is for early detection, because I am literally an example of that. My cancer was found early. I was transplanted. I live a normal life now, and I didn't even think that was possible. But the support groups, I just feel like all of my strength has kind of been drawn from the British Liver Trust and the support groups that have been put into place. And I just can't thank everybody enough. It's done so much for me, so much for my family. So yeah, thank you.
Well, thank you so much, Shona. Thank you for all you do, raising awareness and supporting us. And I'd like to thank you and every other person, patient, who supports us with that work and with our policy and our campaigning work. I just could touch on that policy and campaigning work, because 2 years ago, we didn't have a policy and campaigning team. We did ad hoc bits and pieces. Last year, we had parliamentary events in Westminster, in Holyrood, and in the Senedd. We had multiple debates. Next year, we hope to go to Stormont. And on January the 16th, again, we're going to be scanning MPs in Parliament. And I love Pam's phrase on this. It's a bit like a geography field trip. When MPs come along and they get scanned, they start to understand. They start to understand what Shona and our other patients have been talking about this evening. And we've also been holding visits to liver units where MPs have actually been going along, visiting a liver unit, talking to clinicians, talking to patients. And again, it's about them starting to really understand, and that means they start to support our messages and to support us in getting change so that we improve standards of care. The next year, we're probably going to see a general election. And we at the British Liver Trust, we're already starting to plan for this. I think it's going to be a huge opportunity. It's going to be lots of new MPs sitting, and we hope that we can start to really engage them and get them involved in our all-party parliamentary group, which is something that we run the secretariat for. One of the key things that we campaign for is early detection, because we know so many people are diagnosed when it's too late. And we're going to be relaunching the results of our survey, which looks at the primary care commissioning. And of course, one of the other ways that we do this is through our Love Your Liver campaign. Our Love Your Liver campaign supports all of this work by raising awareness of the risk factors and scanning people on the roadshow. And I'm delighted to introduce our last patient speaker, Veronica. Sadly, she couldn't make it tonight in person, but she did record a little video for us.
Hello, so I'm Veronica Reynolds, and I have a fatty liver, or had a fatty liver. I no longer have a fatty liver, and I was diagnosed with that when I attended the Love Your Liver roadshow at Milton Park in October 2022. I saw the Love Your Liver unit was coming to our workplace, and very sadly, my brother had passed away from liver cancer in about 2.5 years ago. And so I'd just been a bit more aware about liver and liver disease generally. And I thought it would be a good idea to go and get checked out. So I went to the Love Your Liver unit for a liver check. So when I attended the unit, we were first given a fairly long questionnaire to look at, and asked all about lifestyle and foods and diet and drinking patterns. And I answered that, and I was feeling quite smug because I like to think I had quite a healthy diet. I mean, I did always have like a bit of a sweet tooth, but I felt my diet was pretty healthy. I don't drink excessively at all, and I just thought I was fairly healthy. So I went through the questionnaire, answered all of that, and then I was called into the booth to have my FibroScan done. The nurses who are carrying out the scans are fantastic. They're so professional, so supportive. If you've got any fears about going, then you don't need to have any fears because it's extremely well run. So when we first went into the unit, we were given some leaflets and some documentation about keeping a liver healthy. And again, I kind of looked at it and thought, well, that's all right, that's not me. I'm pretty healthy. I have a fairly varied diet. I don't drink excessively. So I looked at it, but it was more of a cursory glance, really. I'd always prided myself on being very active. And whilst I knew I was overweight 2.5 years ago, I didn't think that that would be affecting my liver. So I kind of didn't really pay too much attention to it, although I was quite surprised by some of the focus on non-alcoholic fatty liver disease, which I was aware of, but again, I didn't think it would apply to me. So I got up on the couch, and you just sort of pull your jumper up a bit, and they apply some gel, and it's a bit like going for any ultrasound scan. And then they place a scanner on you, and they take several readings in the area of your liver. It's completely painless. It's just a ping. It took a little while to do that and to find my liver and find the area under the ribs. Anyway, completed the scan. And then the operator sat me down and said, "Oh, your reading is quite high. Do you think you know why that might be?" And then asked me about drinking. I said, "Well, I don't really drink. I might have, certainly within the guidance of 14 units a week." So I was a bit of a loss, really. And then when I stopped to think about it, I thought, actually, having looked at that leaflet, I probably do have quite a lot of fat in my diet. And so I was shocked, actually. I was in complete shock. I never expected my reading to be that high. And, it's explained to me that a reading that high, they would refer me to my GP for further tests. I think the shock really made me sit up and think. And I knew I had to do something fairly radical and lose a significant amount of weight to make a difference to my liver. So, but the fact that I'd had that result gave me the motivation to really look at my diet and switch to a healthy diet. Not go on a diet as such, but just replace any unhealthy foods with healthy options. I really recommend people go and get their liver checked if they get the opportunity. It's just a great privilege to have that insight into what your body's doing, and I hope that that you don't get a high reading, but if you do, know that you can do something about it before it gets too late. Because I think that was the thing that really shocked me, is that this was happening inside me, and I had really no idea, and it was slowly killing me. For want of a better phrase. So I'm eternally grateful to the colleague who talked me into going. I was a bit nervous because of my brother's situation and having had liver cancer, but I'm so glad she talked me into it. And I thank her pretty much every day. I say, thank you. You know, actually, I've got to this point thanks to you making me go. So yeah, I recommend anyone goes to it if they get the opportunity.
So thank you, and I find that video so powerful, because as a result of going on our roadshow, Veronica sort of, you know, changed her lifestyle, lost a lot of weight, and you know, she's now had a reading that is completely normal, and her liver has repaired herself. But as she mentioned, if that hadn't happened, you know, it would have been you know, quietly destroying itself. I just really want to thank all of our speakers. I actually feel quite emotional, and it's so wonderful to hear your stories. I'm very, very proud to work for this charity, and we are working tirelessly to make sure that next year we raise more awareness, so that we can you know, raise more awareness of the risk factors of liver disease, but also use our Love Your Liver Roadshow more than ever before. We want to fundraise so that more people do our online screener about the risk factors. Over 350,000 people have now done this. It's really quite amazing engagement. But we also want to take the roadshow out, and we want to scan more people. We want to find more people like Veronica, and we want to, ultimately, we want to save more lives. And this is what this week's Give campaign is all about. Every single donation is worth double, only happens once a year, and this is what we're raising money for, to keep the roadshow on the road so that we can visit more places up and down the country. So thank you once again to all of our amazing patient speakers. I'm going to pass back over to Pam.
Thanks, Vanessa and Kevin, Steve, Shona and Veronica. You know, really want to re-emphasize that we can't do any of this work without our donors and our amazing patients who are happy to share their experiences. So, you know, really thank you very much. We really, really applaud you. And really, I want to say a really heartfelt thank you for coming tonight and for all your support. You know, our guest speakers been fantastic, absolutely fantastic. And it's really powerful to hear firsthand how our services impact patients' lives. And we are very grateful to all our patient volunteers. And I was lucky enough to be have been lucky enough to go with MPs to a couple of hospitals. And when the patients say to the MP, look, you need to change this for other people, please go away and do your job and change it. It's very powerful. You see MPs in tears. Because they suddenly realise how important liver changing and bringing about early diagnosis for liver disease. So I'm very lucky I have a privileged opportunity to see that interaction. And so I know how patients speaking honestly and truthfully about their lives can absolutely change other people's lives. Tens or thousands of other people's lives. So really big thanks indeed for you all to coming today. So we're looking forward to another busy year in 24, doing more for liver patients and families than ever before. So thank you very much for coming along, and we wish you to have a very restful and a happy Christmas and New Year. If it's not too early, is it too early? I don't think it's too early to wish people a happy Christmas. Thank you so much, and hopefully see you all soon.